Georgia is one of 3 middle-income countries, together with Moldova and Bosnia and Herzegovina, and there is the component expertise on demand. And it is this case, the Care Economy initiative, I'm afraid to say project, but I'm sure that the UNDP integrated to this initiative in its innovation programs. Well, we are more than happy to support Czech expertise in a frame of global networks of UNDP. I repeat again, this partnership fund is a vehicle to distribute Czech expertise in partner countries. And well, again, we are more than happy to support our researchers to be active and develop the evidence-based and sustainable solutions to fill some socio-economic gaps partially caused by COVID-19. As I know, this focus on post-pandemic situation is a unhappy coincidence, but kind of indicator of flexibility of this partnership. So I'm very often admiring this ability for applications of innovations in Georgia. Yes, it's sometimes very affect me because I'm from Central Europe, and some innovations are applied hardly there. And I'm sure that not only me, but other people involved, experts and managers, will return to Czech Republic with some lessons learned how to apply innovations. But on the other hand, Georgia has still a lot of challenges, specifically in decentralization. And me as a representative of EU member states, I should announce on all meetings, decentralization is a European way how to manage public administration, including social services. And we as a Czech Republic supported more projects directed to community-based social service planning. And I can promise here, on behalf of the Czech Republic, we will continue in advocating and supporting this approach in service, social service. At the end of my short speech, I would like to encourage people in the field, all caregivers or all social assistants, social workers, good strength, courage, and enthusiasm in their work, especially in current situation. Thanks again, and I wish you a very productive conference.
Thank you so very much. And I'm happy to see that Luisa made it in time to start her speech. Thank you very much for joining, Luisa. I know that it is your 3rd official Zoom conference today. So over to you, and please unmute yourself.
Thanks very much, and great to see so many friendly faces, and I'll say friendly names, because this is how we appear on Zoom sometimes, as a friendly name. I have to apologize if my internet gets a little funky. I am in an Airbnb in Zagreb, and so sometimes I go into a submarine and things get a little metallic. So just wave your arms if I get distorted. But just to say how happy I am here today to be co-hosting this discussion of care economy with the support of our Czech experts, and really to start by thanking Jan and all of our Czech friends for really an excellent and long-standing partnership that we've had. And really this sense of security we have, that when we need expertise, we can turn to, I don't know whether to say Czechia, the Czech Republic for support, and quick and targeted support. And the care economy is no exception, but also on this side of innovative work and looking at behavioral, especially behavioral science and what it tells us about policy change. And anyway, so we're very, very grateful for this partnership, and not just on care economy, but in so many areas. We have worked together, and the Czech adjective is, we've just written our 5-year country program for UNDP for Georgia, and it's going hopefully to headquarters tomorrow to be locked. And the Czech space is very prominent in that document. So we're very pleased to be looking forward also to going forward. So big thanks for that, and to our experts. And just to say a few words about care economy, because this has been one of my, sort of, I don't know if I beat people over the head with care economy, or I entice them with the vision of care economy. But I have to say, it's one of those areas where, in life that you go to a lot of presentations and a lot of lectures, a lot of discussions. This is one of the few occasions I can remember where I went to a lecture and it was so persuasive and exciting that it has really shaped a lot of my career since then. It was given by a lovely Turkish feminist economist who had done research in Turkey on what happens if you take the same amount of money and on the one hand you invest it in physical infrastructure, so building things, building roads or building buildings, and then if you take the same amount and you put it into care infrastructure, care services. So in this case, it was what happens if you fill the entire gap in Turkey of preschool care and so small children care, which was proven to be, as you will hear, similarities to Georgia. The need to take care of children was one of the big factors explaining a huge gap in labor market activity rates between men and women. So what if you filled that gap? Then what would happen? And what they found was, yes, if you build things, you create some jobs, but they're thin and they're not high quality jobs. If you invest the same amount of money in preschool care, kindergartens, you generate a huge amount of jobs, many of which are for women, go to women, but many of which also go to men, and they tend to be high quality jobs. So their case was that, okay, let's do this. This is not a cost. Care services are not a cost, but it's a triple win. So you drive growth through creating jobs that are job rich for women. You create high quality services for people who need care. So this is so often in the home. It may be to a higher standard, maybe to a lower standard, but you create care services for children, for elderly people, for persons with disabilities, and you relieve that unpaid care burden that keeps so many women in the home. And we know this is the case in Georgia as well. So it's something, ever since I heard that and had the numbers, and I think this is one of the things driving what makes this Czech expertise so successful, is you want to base policy decisions on evidence. So here was this empirical evidence from Turkey, the case, but also in a very, very nice ideological, or say, principle package with this care economy, or they were then trying to call it purple economy. But anyway, so that's why I am a big adherent of care economy. And I was in the country now known as North Macedonia before coming to Georgia, where we did something that was unconsciously very much like building a care economy from the bottom up, exactly through what Jan is saying, through decentralization and through municipalities, and seeing that actually the needs everywhere were the same for elder care, for care of persons with disabilities, and for small children. And this is standard. And that when we funded through municipalities part-time work for caregivers and provided training and professionalization, we found that exactly, it was 85% of the beneficiaries were women, that once they went through this short sort of 6-month process, they were almost instantly hired for full-time jobs. And the municipality then discovered that there was a need everywhere for care services to be either funded directly by the state, the municipality, or through private caregivers, but who received funding from the state. So this very long introduction, I apologize, but I get very excited about care economy because I think it's something that, is UNDP's core kind of reason of being is to come forward with solutions that are integrated, that cover a lot of sectors, and that above all, promote the goals of gender equality. So that's why I'm so happy that we have these researchers who've done work here in Georgia, and I'm looking forward to hearing what they have to say and how we can move this from an expertise position, learning, to policy and actually piloting, or even piloting and scaling up, which is always our development ambition. So with that, I really thank everybody for joining. Thank you for listening to me get a little bit breathing too fast over care economy, but it's something I feel quite passionate about. And with that, I would turn back to Khatuna to introduce our speakers, I hope.
Thank you so very much, Louise.
And looking forward really to a great discussion. And please don't hold back, because we have had discussions like this in the country office where care economy runs into some very impressive intellectual challenges. You really want women to do care work for the rest of their lives, even if they get paid for it and things like that. But we can do that down the road. But anyway, thanks again, Jan,
excellent,
in particular, and our Czech partners, and everyone who's here today, and look forward to pushing this agenda forward together. Thank you.
Thank you so very much. Thanks a lot. I will hand over to our agenda project lead, Benedikt Hosek, who will be taking over the moderation at this stage, and we'll let him present our wonderful presenters. And I will ask the participants to participate actively in the discussion that will follow the presentation. Thank you very much again. Thanks. Over to you, Ben.
Thank you very much, Khatuna, and hello everybody. It's a pleasure to see such a rich audience that we have from the policy circles, researchers, development workers, but also from local municipalities. We are joining two activities together in quite, I think, a natural way, with three Czech experts and professionals featuring during today's roundtable. The first circle is that of the research community. I can see several members from distinguished institutions here, which Khatuna and her team have been working with to establish a network of policymakers who work on evidence-based policymaking, researchers who work on evidence-based policymaking. And our attempt of today's discussion is to connect you all with a second set of the audience, which is that of practitioners and of implementers regarding this sector of care and provision of care. So we are joined by workers from civil social service departments from local municipalities. We're also joined by representatives of ministries and state institutions. And with this second set of the audience, my project, the UN Joint Program for Gender Equality, which is funded by Sweden, we have been developing some research insights together with our Czech experts, basically assessing what the situation is regarding care provision and identifying the gaps on which we would focus on in our programming in the future. So you will hear just in a minute the presentations of the sort of intermediary results of all of this work, with hopefully a chance to have a rich discussion afterwards. So our first speaker is Jana Válková, who's a senior researcher in social policy and gender at the Masaryk University in Brno. And she also works for the EU funding scheme Interreg Central Europe. She's responsible for projects in industrial innovation, social economy, labor market integration. She also evaluates interventions of programs. And she, on her assignment in Georgia, and many of you have met with her last year, Jana was looking into the policy framework that governs the care service sector and has elaborated a set of proposals and recommendations. So with this, I would like to hand over to Jana for her brief presentation of the research and recommendations. Thank you very much.
Thank you, Ben. Good afternoon, everyone. So I will now try to share my screen. Can you see it?
Not yet.
Okay. Just give me a second. Share.
We can
And
see.
now? You see it, okay.
Now we see, thank you, yes.
Perfect. Well, thank you very much again for organizing this roundtable and for inviting me to, let's say, present preliminary results and output of the work I've been involved so far in. And also thank you very much to Luisa and Jan for mentioning I would say, two keywords. One is care economy, and another that was mentioned by Jan is community approach or community perspective to be considered in developing care services. When I got involved in this project, and it was indeed titled as Promoting Care Economy, I really invested a lot of time in researching how care economy is conceptualized, because for European context where welfare states are quite developed, we are rather talking about care services, and they are mostly public. In most of the countries, the majority of them would be provided on public on an NGO basis. And so when you say care economy, it also associates with privatization or so-called McDonaldization of care, so that it's something that you can buy on the market. And I was looking for more suitable concepts that would help me really approach the Georgian context and understand and to see what's and how care economy actually should be understood and should be developed. And so I came across this let's say, a circle diagram that was used by ILO in their publication of Care Work and Care Jobs that talks about the division of paid and unpaid care and the role of paid care work in, let's say, mediating this relation between unpaid and paid work. Because, I mean, of course, clearly for women, and especially in Georgian context, the unpaid care work burden actually prevents or is a burden for women to enter the labor market, formal labor market. And you can see that also on the disparity in employment rates in Georgia that differ between women and men by more than 20 percentage points. And so I kind of, let's say, conceptualize it as the orange part of this circle. So that what we should focus on is really developing the possibilities to, let's say, access care work that would be formalized, so that it allows women that are burdened with unpaid care work to enter the labor market. And also part of these women can be indeed employed in care sector, as Luisa already mentioned and outlined. So looking at the data for this orange part of the circle in Georgian context, based on labor force survey, you can see that in those sectors that are relevant, it's mostly women that work there. And in human health and social work, we can find 19% of men, but I would suppose, and I didn't have more detailed data, but I would suppose that it's doctors, medical doctors. And so you see that this sector is really, really highly feminized, but yet still it doesn't mean that promoting more job opportunities in the sector wouldn't be bad. It would probably contribute to higher horizontal gender segregation, but still it would contribute to economic activity of female labor force. So that's it. And then also looking at the green part of the circle, how unpaid care work is divided. This is a diagram from a survey that was run by UNDP and UNFPA on public perceptions and attitudes. And so it clearly shows that when it comes to the domestic work, it's mostly carried out by women. And when it comes to caring for children, more than half of this type of work is again carried out by women, and maybe half of it. And this is only perception of men that were of male respondents. And so how the care is shared between women and men, and only 4% men uniquely involved in that. Unfortunately, this questionnaire doesn't contain questions about care for elderly people, but this will become in Georgian context due to aging more and more relevant. So I hope that with the time this topic will also get into the questionnaire. And so having a look at the dependency ratio, when I talked about that care for elderly will become more and more relevant and burdensome also. These are estimations by the World Bank, and they are quite in line with estimations by ILO from 2019. And so you can see on the in the chart that estimation for 2035 is that the dependency ratio for elderly people above 65 years of age would be 0.3. So it's a comparison of this age group against the age group 15 to 64. So the society will be aging. The care burden in terms of childcare will be smaller than it is now, but the, let's say, the demands for eldercare will be growing. Okay. Yeah. So the objective, but Ben has already kind of introduced what I was doing. The objective was really to analyze the policy framework and probably to come with recommendations for the regulatory, legislative, and investment initiatives. So the aim was really not to analyze everything and come with recommendations for every single element in the whole policy making and multi-level governance approach to care services, but to really come with recommendations that are feasible and that can also be supported by UNDP, let's say in short or medium horizon. Beyond the desk research that was, let's say, I would say like 50% of the whole work with the data. So beyond the desk research, I also went on a mission and carried out 15 interviews with funders, with regulators of care services, and with care service providers. And my main, let's say, approach was to discuss with them the accessibility of the services, affordability, and quality, and the policy framework and funding that relates to these, let's say, aspects. And so I focused on childcare and eldercare, and now I will probably provide only, let's say, a helicopter view, because there's no time to really go into all the details of the findings that I came across. But when it comes to accessibility, in childcare in Georgia, the enrollment rates have increased quite significantly. And so for children aged 4 to 5, the enrollment rate is above 83%, which even in international context is actually quite a good proportion. And also for children aged 3 to 4, 73% of children in childcare, it's a very good result, and this is due to the policy change that childcare has been made free and accessible for everyone. Anyhow, and also due to this, the demand for childcare has grown. Because it became free and more accessible, and so the municipalities are now obliged to provide the places. But according to care providers that I have interviewed, still in certain municipalities, quite a high proportion of children cannot enroll. So on an example of Rustavi, for instance, even though the budget invested in childcare by the municipality has grown more than 4 times over the last couple of years, still there is around 700 children that can be placed in the kindergartens. And the existing kindergartens are overcrowded by more than 3,000 children. So this policy change on one hand should have increased accessibility, but on the expense of quality. Here also you can see the quote on the slide on the topic of quality. The kindergartens are breaking the law. There are often many more children in the group than required by the law. And so for the recommendations, I would probably pick just only some that are, let's say, the most relevant. it's really important that the quality standards that are already in place and that are existing, that are equally applied to public and private preschool education institutions, but also when it comes to governance of the whole system, that these quality standards are really enforced and that the monitoring and control system is put in place and is independent of from the municipal level. Because currently, as the municipalities who are establishing the kindergartens, but at the same time, they are responsible for monitoring quality. Because Ministry of Education is responsible for approving the curricula, and then there, on the other hand, there are also checks on quality of water, food, and so on. But the checks on when it comes to number of square meter per child and all these other quality standards, these are not carried out, or if they are carried out, they come in form of recommendation, but they are not enforced because these checks are done by the funder and not by an independent body. So I think this is, when it comes to governance of the whole system, a major, really striking thing from an outsider, from someone coming to Georgia, looking at how things work. And I think this is a great opportunity for thinking how to change the quality monitoring. And another thing out of the list of recommendations that's drafted and that I think is important is indeed, so now municipalities are responsible for providing childcare, but it's a very big financial burden for their budgets. And so they do it on the expense of quality. And nobody really addresses this point. And I think that indeed community level discussion about how to improve the situation, not from one year to another, but maybe in some kind of 5-year horizon, to put in place a planning process and a discussion process how the municipalities want the kindergartens to actually comply with the quality standards would be very valuable. And this is also in line with other recommendations also for eldercare or the care services sector as such, that I will talk about later. So now for the eldercare, when we look at what is available in Georgia, there are a couple of, let's say, inpatient long-term care nursing homes. And the chart from 2019 shows that actually the demand and the supply are quite in line. So there was some optimization carried out so that in 2017, more or less as it looks from the chart, the needs should be, let's say, saturated. But another study from 2015 by UNICEF actually points out that it's a very big stigma also in the questionnaires and surveys for the respondents to answer that they would need such kind of service for a family member. So the estimations yet still are such that there would be more places needed. And this is also in line with estimations of the caring needs, that 2% of population will need some, let's say, intensive care by 2030. So this much for inpatient care, but of course, as I have mentioned, it's very stigmatizing in Georgian cultural context to put a family member in a nursing home. So then I was also looking at what is available otherwise for other type of care for elderly people. And there was a study by CTC about availability of services and availability of home care services for elderly people. And this study provides an insight on what is there among state programs that is available for elderly people. And so you can see from the table, there are some programs that elderly people can benefit from, but only 7 of them, 7 of the total of 45 are targeted at elderly people. And out of these, many are actually providing, let's say, palliative care or are providing funding for palliative care or aids, but not really for home care. And when we go down and look at the municipal level, there's also a number of, let's say, programs that elderly people could benefit from, but many of them provide financial aid. And as the study points out, this financial aid is very often just one-time payment, or it provides contributions to cover medical costs for medical care or for let's say medication, but very little financial means are available to actually fund home care or respite care for the families that are the main principal caregivers in the family. And coming across several other studies, it seems also in Georgian context that home care is, let's say, more in line with the cultural norm. And it's not so stigmatizing for the families, and it's also better accepted or even demanded by elderly people. So the same study actually pointed out that, yeah, a 92-year-old person said there should be a service that would visit old people, look after them, etc. And the study by World Bank actually pointed out here, really, my ancestry will not allow me to even consider putting the family member at the senior home. So really the preference for home care or some kind of respite care or daycare is apparent coming across several studies. And this is also what I learned from the interviews that I carried out with providers, but also researchers, and so on. So from the perspective of providers, obviously, from the data and also from the interviews, clearly there is need for funding for home care. But of course, it's not always and only about money. Care services can be costly, but money is not the only solution that is needed. What was also articulated quite clearly is that there is a need for trained staff. And the actual and available training in Georgian context is too long and too demanding. So if you enter a nursing course or a study program, it takes too long to really actually then become someone who provides direct care and works with the client. So then probably also the expectations of these graduates would be different than work in direct care. There is also a need for stable collaboration at the local level, and this will bring me to the point to highlight the approach of community planning of social services. Because what I learned from the interviews is that if one provider works in a municipality, but then with a political change, there is a decision to take another provider who will service many more clients on the expense of quality so that it can be presented that higher numbers of people were serviced, then it's not a good solution for the end user. And that's why the community planning of social services is really a valuable approach. And the last point that I would like to mention is the need for quality standards and control. So, so far quality standards have been drafted for home care, but haven't yet been adopted unless it happened very recently, and I'm not aware of it. And this is something that is also a starting point really for development of the sector. Now, because I am on full screen, I don't know whether I haven't used the time fully that I have had. Please tell me someone then.
You have, but we can spare a quick minute for some wrap up.
Okay, so for the wrap up, yeah, so the recommendations, I basically mentioned them, and they stem from the interviews and also from the research as presented. And I just wanted to shortly to talk about the approach of community planning of social services, which is really a method to plan social services at the local level. And the mission of it is to ensure that the social services are actually available And what's most important is the dialogue, or actually trialogue, because there are 3 parties involved, and the negotiations and achieving a result that then is accepted by all. And so what are the 3 parties? These are funders, so municipalities, but it can also be region or state. In Georgian context, I would imagine it's social service agency and municipalities. Providers, social service providers, NGOs, but also state or municipal providers. And the important element in this whole process are end users, clients of the social services, their family members, or members of their associations that would really advocate for the needs of the end users. And from the Czech context, because we have this process in place for 15 years in the Czech Republic, the experience is that the involvement of end users is really an essential element, and it brings very, very valuable information, because what the municipalities usually do is that they run studies, needs analysis, they have external experts who actually map what the needs are, but they are still always lacking the perspective of the end user, and through this process, the people get heard. I would probably just quickly wrap up. So the whole process is about really asking the questions: where are we now, where do we want to be, and how will we get there? So the first step of the whole process is to carry out the needs analysis, not only quantitatively, but really bringing people on board and discuss with them what is needed. Then setting priorities. This is also important, very important element in the whole process, because it's not only about people claiming what they need, but it's about really understanding how much money we have for this and what can be done and what is feasible in short term and what is feasible in long term. And all parties have to understand that the available budget might be limited, but then it's about discussing how to use it most effectively and meet the needs of the end users. And then it lands with drafting an action plan, usually for 2 maximum 3 years period. This method, I mean, it's widespread in the Czech Republic, but it is also used by big cities across Europe, like Barcelona or Vienna. So I could talk about examples how this takes place in other countries too. But I think I've used my time up. So one last thing that I wanted to mention, and Ben will probably then inform you more about this, is that one of the recommendations also was to actually set up a training program, short-term training program that would contribute to, let's say, generate a labor force suitable for eldercare field. And so the pilot project is already running, and there was a training of trainers that took place already. And for more details, I think Ben could probably answer your questions.
Thank you, Jana. I will indeed say a few words about this later, but thanks for this sort of helicopter overview of where we are at in terms of accessibility, quality control, but also the human resources and capacity in the 2 fields of care. And you pointed out to some of the trade-offs that it feels like it shouldn't really be a trade-off between making a service accessible and good quality, but we all know, and our colleagues from local municipalities certainly will agree that the resources have to be distributed somehow. And I'm glad that you pointed to one of the pathways of how to think about it, which is the involvement of the community to, in discussion and through participation, determine where scarce resources should be allocated. And I think this is a nice segue to the next and second and last quick presentation, which shifts to the very, very local level. It will be given by Jan Říkovský, another Czech expert, since Czech is the theme of the day, who is an aid worker and lecturer and interdisciplinary researcher at Caritas College in Olomouc, Czech Republic. And he has a pretty varied background from public economics, disaster risk reduction, but also international social work. And he examines different developmental challenges with a behavioral angle and focusing on the solutions. And this was a very useful perspective when Jan came to Georgia at the end of last year, where as part of this work on the care economy, Jan looked at the concept of a daycare center, one existing in Samegrelo, in Chobe municipality, and one prospective, to try to understand how to make this sort of community approach to care provision work smoother, work better, and more effectively to reach as many people as possible with a quality service. And Jan will give us a quick overview of how he approached the problem and what sort of experience he has had in looking into this very micro level, so very, very applied service provision. But I think it tells quite a lot about the approaches in the community involvement when it comes to social service planning. So with this, I'll pass on the microphone, the unmute button, to Jan for his quick intervention before we move to the Q&A and discussion of this topic. Thank you very much.
Thank you very much, Ben, and Gamatoba. I'll try to share my screen. Hopefully it will work. And I can see only the screen, so yeah, can you see it?
Yes, yes, perfectly.
Good. So I'll try to be as brief as possible, but I sometimes fall behind my ambitions in this, so please let me know if I'm running out of time and it's time to go to sleep in Georgia, because you are 2 hours ahead. As Ben said, the focus of my research was very practical and local. So I tried to look at the micro level and try to bring some solutions for the case study of the daycare center in Chobe Samegrelo, working with children with disabilities and their primary caregivers as well. So I tried to bring some solutions that can be immediately applicable in the current situation, regardless of the context, to say, the policy ambitions, to say, but also with the prospect and some strategies and tools to achieve the macro level change, to achieve the system level change. So the ambition of the total proposal was to achieve community-based solution, as is in the title of my presentation. Community-based solution, needs-driven, and therefore hopefully sustainable solution. So this was the originally intended outputs, and as Ben said, the situation on the ground was a little bit different. So I will now focus on the case study of the existing daycare center for children with disabilities located in Chobe, which started about a couple of months before I arrived in Georgia, or before I started my assignment in last autumn. So the target group for this was children with disabilities, but also the caregivers. The approach I tried to adopt for this proposal was based on the literature review and the pre-mission report internally to focus on holistic and individualized model of care. What means focusing not only on health issues, which sometimes is the situation, but also mental, social, and spiritual well-being of all people involved, especially the target of children with disabilities, but also their primary caregivers. But on the same hand, we focused on individualized model of care, taking into account all features or all factors of all involved individuals, so-called clients of this daycare center. From the external point of view, the approach was taken to achieve a community-based, sustainable and inclusive solution therefore to bring some daycare center which would be open to the general public and linked to the community, responding to the needs of the community, to the wider needs of the community, not only targeting a specific and narrow target group. And also trying to build on the resources and capacities that are already existing in the community in order to achieve the practical solutions that can be achieved at the local level without relying on the national or regional level. The road to the proposal or the methodology was as follows in this part of the presentation. So there was a literature review where I tried to assess the community-based or to assess the community-based interventions to find out the specifics and needs of the target groups, especially in the context of Georgia, theories and models of working with target groups, and international best practice examples, including contextualization given the culture and system and policy differences in Georgia. The proposal draft was then prepared before the mission, and during the mission there was a primary data collection and assessment of the current situation of the center because it was already existing at the time. And post-mission, I collected some additional data based on the network I built during my stay in Georgia, and I tried to verify my findings with the service providers, with the daycare center, and try to prepare the theory of change. And then was the final proposal and validation, which is basically in this diagram. This is the final proposal. So I will try to take you through this proposal, starting from the needs that were analyzed, to the objectives and the solutions, how we can achieve the objectives, and what is the overall outcome, the conclusion will be at the end. So first of all, sorry, I will go back. First of all, because we are running out of time already, and so I'll try to briefly describe what were the needs analyzed, and it's basically stereotypes against children with disabilities, and sometimes also stereotypes about the primary caregivers, the insufficient social protection system. Education for children with disabilities is not completely up to their potential. There's a primary caregiver burden. Development of children with disabilities is because of the other needs and problems or issues identified is not fully addressed. There is also a little bit of lack of knowledge in work with children with disabilities, limited healthcare support, and linking to the social aspects of care. There is a limited or a potential to increase the parents' knowledge, the parents of children with disabilities, the knowledge how to care, and some operational issues about the center. So this is just to show you a brief and very short diagram of needs assessment at different levels, micro, meso, and macro level, and core issues identified with regards to this daycare center. And this is mainly around the topic of individual and specialized work, sustainable finance and staff engagement, adequate and utilized space, and quality and complexity of intervention, and last but not least, caregiver support, which is sometimes omitted. This was supported by the simplified problem tree. I'll just show you. It looks, and also the capacity and opportunities assessment to take into account not only what is needed on the ground, but also what capacities are in place, and there are many of them, including local and small enterprises engaged, or volunteers and communities engaged in the caring of other people. So this is about the needs, and out of the needs, we can see that how it translates the objectives. There are 4 main objectives that derive from the intended impact, and the intended impact lies in 2 areas. First, to improve the lives of the children with disabilities and to promote their social inclusion by offering quality daycare service rooted in community. And secondly, improve gender equality, but not only gender equality, by providing respite from unpaid care work while simultaneously enabling them to participate in the labor market and supporting their well-being. So to achieve this impact in long term, or hopefully a little bit sooner, we need to address the primary caregiver empowerment. We need to engage the wider community. We need to provide respite for primary caregivers in order to be able to develop their own skills and engage in other activities, and also quality daycare to reach full potential, to be able to reach full potential of the clients, of the children with disabilities. This is about the solutions. This is a simplified theory of change. So this is just an illustration. So we will not spend much time here. But these are the ways, this is the problem to translate it in what we need to do and what it hopefully brings. At the end, this is the children with disabilities are able to achieve their full potential. So this is more about the pillar of clients of children with disabilities reaching their full potential. And these are the solutions depicted in this diagram, that we have around 5 core solutions from the internal point of view, what can be done at the level of the center. And these 4 in the black are related to what can be done at the community level. At the internal level, we are talking about primary caregiver support and capacity building, diversified and sustainable resources for enabling of sustainable functioning of the center, not relying on external funds, staff training and well-being, because it's relying mainly on volunteers, individualized and specialized work to increase the quality of work in the center with children with disabilities, and extended space and operations to be able to root it in the community. For each of these, I prepared detailed theory of change, what needs to be done. So I'll just show you 1 or 2, depending on time, to show you the approach that was taken. So this is a theory of change. What is the specific need? What is the expected change? And what aspect of the proposal is targeting or trying to overcome or bridge the gap between specific need and expected change. There's also rationale behind that's rooted, as Ben said, not only, but also in behavioral science. So taking into account a different point of view than is the traditional one. And I'll show you just 1 or 2 examples of the most transferable aspects. So this, for instance, is about the primary caregivers, and we can express in a simplified way that they do not often take care of themselves. Maybe they don't know, they don't know how to, they don't have time to, they lack other support and so on. So the expected change is that they are able to achieve and sustain their own long-term well-being, and not only because of those that they care of, but also because of themselves and because of their functioning in the society. There should be some trainings for primary caregivers. For instance, it can be a mindfulness-based stress reduction, which is quite a simple technique, but it's proven to be very effective in contrast to some other more sophisticated techniques. or there can be some space for the primary caregivers while the respite care is provided, while their children is taken care of. They can be matched to long-term gradual development, so they can be supported in running their own projects or developing their skills and capacities, also at the premises of the center. So this is one of the examples, detailed explanation of the solutions.
Just to be mindful of time, if you could, move to.
Yeah, I'm keeping up for only 1 minute, so I'll just show you this one as one example, and I'll try to move on to the conclusions. And when there is interest, we can discuss this later on, or I will be happy to share the report later on. So these are the two examples regarding the community cooperation, while widely rooted in the community, the services, and also relying on the volunteers and community members, not only on those 5 that are currently engaged, but linking the needs and the capacities that are existing in the community. So, for instance, using the active aging club for the elderly that might be started, and they might be able to support the activities in the daycare center. And this is about the full utilization of the daycare center, because there's a space, and it can bring only not only people to the center and give them some meaningful space to do their own activities, but it will also link the majority in the community and those that are marginalized. And by linking them, hopefully the stereotypes will be overcome soon. So this translated in the operationalization, and there was a proposal how to prioritize, because there were so many steps proposed. So I proposed how to prioritize there, and basically we shall start with quick wins, the efforts that have high value but the low cost and low effort, and then big bets that those efforts or activities that require a high effort but can bring high value, etc. And this is a detailed implementation plan. Again, for illustration, starting from finance to developing practical skills of caregivers, the quality of daycare center services improvement of well-being of caregivers, operational issues of the center to sort it out, and to increase the service impact and cooperation overall. And I'm at the conclusion at the moment, because I was trying to link the micro or local level with the macro level. I tried to show that there's a possibility of success stories at the micro level. It can work and bring some results in spite of the system, but it will bear fruits mostly if the system allows or ideally promotes such efforts. And at the end of the day, it's very effective. It promotes bottom-up development, ownership, and sustainability. So that's all from me, I think. I hope I'm in time a little bit here. So thank you very much.
Thank you very much, Jan, and I'm sorry for rushing you a little bit. I just wanted to make sure we have enough time for discussion and we don't keep the audience for too long.
That's fine.
But I think you showed us that even the smallest interventions are not simple, because the simplified theory of change was indeed still quite complex, and the options that we have in improving and delivering care to different target groups are many. So the prioritization that you showed at the end, I think, is a really useful framework of thinking about how to follow up on all of these all of this research and all of this knowledge. I just wanted to very quickly, in a couple of minutes, on behalf of the UN Joint Programme for Gender Equality, outline how we try to follow up on all of this information, which I hope will also be an opportunity for you participants to give us some further guidance and feedback. So to start with what Jan was presenting, this daycare center is a quite nice example and a sort of pilot to see just how far can we go in implementing this set of recommendations. And unfortunately, we were able to pair up with a sister project of UNDP on the inclusion of persons with disabilities, which is currently formulating what type of support will be exactly provided to this and other community centers like this. But basically it follows the lines of some capacity development of the staff, also a strong focus on the well-being of the carers themselves, because as Jan mentioned, and especially during the pandemic, this is very important to avoid any sort of burnout, etc. But also, and the third one is the expansion of the target group. I think that a very interesting point Jan made is that often care services can be sort of bundled together, that one benefits the other. Providing respite care for a certain person can allow that person to focus on other things which are not necessarily care, perhaps employment or others. And that a daycare center for focusing on after-school activities can actually focus on other target group in the morning when that space is empty. So this kind of combining the wins together is one part of the focus that we try to have with our very micro level support. And along the other lines, as Jana had already mentioned, we try to work on the gaps in the system of care, especially focusing on elder care, as this is, I think you will agree, the least systematically developed in Georgia, where in the first instance, we are working towards developing the capacity of carers through establishing a short-term vocational education course for home care workers. These short-term courses have been proven to be a really effective way to provide quick skills, especially for women and other vulnerable populations underrepresented in the labor market, for pretty successful high success rates towards employment. And so we're hoping that this kind of training will enable a much wider rollout of home care services by municipalities and NGOs alike. From the capacity, we move towards piloting, where I already mentioned the daycare center in Hobby and hopefully others to come. But in the future, and for this we are in close contact with several municipalities, including our colleagues from Zuglidi that I greet here. We are trying to think how best to establish a home care service provided by the municipality, but which also can be a sort of prime example for how good standards of care can be maintained, and use that as a model for the third step of programming, which is the policy work. And as Jana mentioned, availability of services should not be traded off towards the quality of services, and the quality can be guaranteed by, for example, a good set of standards which allow for a good baseline of the care standards provided by that service. And so we're hoping to work with a municipal home care service in order to figure out where this kind of threshold, where the trade-off between availability and quality lies, in order to promote this then at the policy level. So this is in brief what our approach lies in, and we have already started several of these activities, and we're hoping to continue with others. And not to spend too much time on the theory, but to get into the practical discussion, I will hand over the microphone to our third and final Czech expert who will moderate what is left of our time. We can hopefully run over a little bit from the scheduled 1 hour and a half. And our third expert is Karla Koutková, who is a behavioral science expert. She holds a PhD in public policy from the CEU. And she works as an anthropologist for the Czech Academy of Sciences. And she has collaborated with UNDP in Georgia on applying behavioral approaches to research. And she supports the innovation portfolio in helping the community of researchers present here to improve the approaches to evidence-based policymaking. So I will steal the first question from you. I hope you will forgive me, but I was hoping to get some comments from our experts on how the COVID pandemic, the thing that we all avoid to mention but cannot at the end of the day, how does that influence the care sector? I know this is a very broad question, but if we get practical, first for Jana, how do you think this increase that has been evidenced during the pandemic, the increase for the need for care services, will it last? Is it just a temporary kind of pressure on the care services? We have seen this here in Georgia when the care services fail, then the burden is much higher on the domestic carers, but also when the domestic carers who are usually relied upon cannot care for their relatives, somebody has to step in, and this has been a big issue here in Georgia with some emergency care provided for the elderly and other populations. So the question lies around this. Is this just a temporary effect, or will it have some longer lasting implications, also taking into account the demographic trends that we see in Georgia?
Okay, so if I may, well, I think there are two things to it. One is, I mean, in the first place, of course, nobody knows how this will all evolve. So if one day there is vaccine, then the problem might be solved. But anyhow, I think that now the countries that are really heavily hit, and the Czech Republic is one of them in European context, are really, really struggling in organizing the services. So what usually they do, and what I could observe, and what I also, discuss with my colleagues who work at the social care department and the city hall, is that the only solution now to the problem is that people work on shifts to eliminate the contacts. But the problem is that usually when it comes to home care, the care really does take longer because they need to use all this protective material. So that's one thing, that the work is actually slightly slowed down. But mainly it's really demanding in terms of organizing work, so that the groups of workers in one NGO do not really meet, and they are divided in 2 or 3 shifts, so that the number of contacts is limited, because now we are really in a moment that it's very highly spreading. I think we're actually leading the European level, unfortunately. But what also happens is that we have more and more medical staff and also staff in social care on sick leaves or in isolation. And that's where also the community planning of social services comes in, because within the groups they discuss where the needs are the biggest, and the NGOs on the platform of their working group, they can cooperate and also communicate the needs towards the city hall. And then the city hall is trying to organize volunteers for these organizations and send volunteers and mobilize people, even people like me, to actually volunteer in direct care. Because the situation is very, very dramatic. So I think it's a lot until we have a solution in form of vaccine or whatever. or we have immunity, it's a lot about real organization of work, networking, and good communication, also help between and among the organizations. And so what I observe from Brno, the second city in the country, the community planning provides a good platform really for this exchange. However, we are still short of people, and I believe that might also be the case in Georgia. Shall the numbers be higher? Another thing to it that comes to my mind is that once you establish a form of service, it tends to survive. So now when people have, for instance, a family member to provide the care, but if they cannot because they are in isolation or whatsoever, and the care is provided by a formal provider, by an external provider, people tend to get used to a provision of service. So quite often in surveys, you wouldn't have an articulated need for a specific service. But once you put this in place, people actually start using it. And this is what we in public policy analysis call past dependency. So once you provide something to the end users, then you follow the path and it's really hard to take that back. So it's probably also, let's say, a window of opportunity to develop home care services in these difficult times.
Thank you very much, Jana. I won't steal the show anymore. So please, Carla, over to you.
Thank you for the word, Benedict, and thank you for fascinating presentations, Jana and Jan. I would actually not like to delay giving the floor to our other roundtable participants. The format is called Research for Policy, so we are actually uniquely uniting the two communities here in our audience. We have both the research scholar community and the policymakers. So we are hoping that you can actually mutually enrich yourselves in this debate and this exchange. We are also actually titled our event Pre and Post COVID. Obviously, our researchers were working last year where hardly anyone could imagine what 2020 has in store for us. So we are, or they are basically hard at work figuring out what to do with the current situation and with the current programming. So we would very much like to also invite our present researchers to help us think along these lines, how to cope with the current situation. But I will first give the floor to you, if you have any questions for the speakers related to their presentations, to their work on the topic last year. I will collect one or two ideally, and then we will move ahead and discuss in a plenary sort of forum, giving questions to the audience, both the researchers and to the practitioners. So please, if you have, I see already one hand raised, Nino Mirzikashvili, please go ahead.
Hello again, everybody. I'm Nina Mirzikashvili. I represent Ilia State University, and I'm also a health expert. Very interesting presentation, and generally care is very interesting topic for Georgia. And I think we have to work very hard together with the government as well as international organizations and non-governmental sector somehow to push this the topic, because one of the presenters mentioned that this is costly. Of course, everybody knows that this is costly, but somehow policymakers don't understand, and they prefer to allocate budget to medical sector rather to put the budget to the care sectors and to train the caregivers. And also one issue I wanted to underline, there is some talks, as I know, to transfer, because you talked about the community level social services, and of course this is very important important topic for Georgia as well. And there is a talk to transfer the central, so-called federal state social program to the local municipalities. But that's a two issue, because the local municipality, they are not ready for that. They don't want this social program. Another issue is that the service providers we don't have in many municipalities, because you talked about the home care services, and only several municipalities in Georgia have the experience in this direction. And human resources is a huge issue. The caregivers and the volunteers in this sector is very important also. So there is talks how to transfer these programs to the local level, but many questions and many issues. And of course, I think that it should be very well designed. The monitoring tools and Ministry of Health and Ministry of Health and Social Affairs should do the monitoring of the program, because in some cases, municipalities they are the service providers, and they also do the monitoring as well. So as Jana mentioned, like in the preschool education, what we have right now. So that's also a very important topic. So we should talk about this, of course, with government as well. And regarding the home care, I see here Ucha Wahania, who is head of the Home Care Coalition, and we worked very many years with Ucha and Irina Khantadze. By the way, we did the care assessment 2-3 years ago in Georgia, very interesting report, and I can share this report to you as well. And I have a question to Jana, just to summarize my talk, because the very interesting issue, and we can touch every pillar of this care system, because it's a preschool education, it's elderly as well, so many target groups we have in this system, and if we plan this system, we have to cover the whole target groups. Jana, I have concrete question to you. You talked about the preschool education, and do you think that this is also target group of this care system, the children still 2 years and children still 6 years? And also question is you mentioned that they are under the municipality, and how do you see the monitoring of the preschool kindergartens? Should we do the authorization like we have in secondary schools, the accreditation, or how do you see this process regarding the preschool, and if you consider that they are the target group of the care system? Thank you very much for this meeting, by the way, very interesting topic.
Shall I answer directly, or are we collecting more questions?
Directly, please.
Okay, thank you very much for the question, and also, I mean, for the information that you have shared. So to your questions about preschool making it part of community planning of social services, I think the starting point of the community planning of social services really is that it stems from the community. So let's say the target groups should be defined in this process and should be defined by the community. However, my professional opinion would be that preschool education shouldn't be part of this process, because it is education and it is not a social service. In general, I am really not a fan of very big fragmentation of social policies, which is indeed the case not only in Georgia, but in Central Europe very much as well. One example of really fragmentation of this is that the idea of community planning of social services has already been carried out into municipalities as a pilot project, but only with the target group of, I think, adult people with disabilities.
Children with disabilities, I think.
Or children with disabilities, indeed, yes, sorry, thank you, Ben. And this shows, that there has been an effort already to bring this like paradigm shift, through a pilot project to the municipal level, but again, only with very limited target group. And I mean, the starting idea for community planning of social services is that all the needs are discussed, all the needs are brought on board, and solutions for all the target groups are being discussed. So that's why then I didn't have time in my presentation to really explain how it works in practice, for instance, here at our local level. But there are different target groups, different working groups that at some points of time they work together, especially when they have to find an agreement about how the money will be distributed for the next 2 years, or what the actual plan is. So of course, the needs of different target groups might be aligned, because if we think about home care service, it can be beneficial to elderly people, but also to people with disabilities or families with children with disabilities. So there are services that are so-called, I would say, collateral and have several target groups. So these target groups are not competing for the money, but from other perspective, there might be competing. So it's important really to discuss this on a, let's say, larger platform. And it's a very demanding process, especially at the beginning when it's set, so people need a good training. Also, I mean, we have been through this here, and so there is a good example how to actually do this and put this in practice. It wasn't easy, but here it started like in 2005, and it took some years really to train the regional and local level to, let's say, be able to carry out the process properly. Your other question was about quality of preschool and monitoring quality in the kindergartens. I don't think I can now tell you what would be the ideal way of really monitoring quality, but I believe that it's really important that if there are standards of quality, there is an independent body that checks on the providers and also on the funders, so of those authorities that are establishing the providers, whether they comply with the standard. Because why to have a standard? Why to have a very good legal act or a standard where nobody really is enforcing it? And this is what my impression was, that in Georgia, a lot of policy making happens through pushing for new legal, let's say, pushing for new acts and pushing for new, I don't know, governmental decrees, etc. But then the implementation really is like 3 steps behind. And I think that this bottom-up approach is about pushing from bottom for the quality, pushing for, because you already have the standards. So let's just push for enforcing them. I don't know whether this fully answers your question, but.
Thank you. Yes, you answered the question. Many thanks for the information. And yes, you're right. We need to push bottoms up. That's why I talked about the municipality and local communities, because if we want to give them and transfer this, they need to prepare. At least they need to start to prepare from today to train the staff and to know how to manage these services on the local level. Thank you, and probably others will have questions as well. I see Ucha here, who is head of the Home Care Coalition, and with.
Please, Ucha, go ahead.
Hello, everybody.
Oh, I think you're muted.
I'm trying to unmute.
Moment.
We can hear you now.
Does it work now? Let me provide information about ongoing project of Tao Elderly Care Institution. The project is funded by CTC and supported by Bread for the World. And in the beginning of next year, we will have universal web portal for senior citizens and their family members with all kind of interesting issues about aging and elderly care and informal caregivers and so on and so on. And all kind of contributions are very much welcome. Thank you.
Thank you very much for this contribution. With that, unless I see any raised hands for our speakers, not as far as I can see, I would actually like to turn the attention towards our research community for a second, and maybe see if any of you who work at Ilia State University, JIPA, and DSU have any background, any current experience with doing research in on care economy or unpaid labor provision that you could share with us. And also exchange with our speakers your local perspective from having fresh data perhaps on this. So please, researchers, speak up. I see Maka. I see Maka Chitanava. I don't want to maybe put you on the spot, but maybe you are the first expert on this topic that I could see among the group. So, and great to have you here, Maka. Lovely to see you.
Hello everyone. I'm also glad to listen to you and to be here. Actually, I don't have much to say because all information what I possess was already mentioned here, and I will just repeat everything. So I don't have any new things to add to presentations. But I had one question, and maybe I will ask it, and afterwards, when it's possible, so we just share, because it's not only question, but it's also comment. You mentioned this pilot project, and I'm really interested if what will be the outcomes of the pilot project, and do you have evaluation also going on, or are you expecting to evaluate those projects and afterwards see what are results, and afterwards to expand it to the country? And also one thing, while you are doing these pilot projects, have you thought about it, minorities, that they may have different issues related to care, and that's something what I'm really interested in.
I think this ties in with a question that I think Dustin posted, if I'm not wrong, before he left, which is, has anybody done any rigorous impact evaluation? You know, what would these interventions bring? I would turn the question to what is the data that we need to conduct a proper impact evaluation, and what's the potential for it? Because for us in practice, it's still early days. Since we're starting the implementation of first the, let's say, enhancement of the daycare center in Chobi, and also of the rollout of the home care vocational course. So yes, we'll definitely on the second, we'll be following up our usual approaches through looking at basically the employment success rate of the trainees when it's concerning the vocational education training. So in this case, it's a little bit trickier because many of the jobs don't exist. Many of the jobs will be self-employment, and some of them will be informal, and others will be in services that are yet to be created and that are being planned. So I think that the easy method for us as a development organization is to follow the cohort of the graduates of the course and to keep track of basically the success rates. To what extent was the need that we identified but that had not been voiced, since there is not really an active demand for this workforce, but from, let's say, dialogue and circumstantial evidence, we see that there is potential for this service. To what extent has this workforce actually been successful in providing this service? So that's one relatively easy way of looking at it. But if we extend the question to what I think Dustin intended, has there been any impact evaluation, or let's say an estimate of the impact of a set of care economy approaches in Georgia? And the answer, I think, is no, but perhaps you Maka, or others have done some simulations of what would it mean for the society and for the economy if the mix of care services is somehow adjusted or extended or improved. And this is what Luisa mentioned in the opening. One of the very, let's say, macro modeling approaches that İpek İlkaracan works on. We were considering initiating something like this in Georgia, but the data doesn't necessarily allow for it. And in practice, this is we had discussions about this with Jana, and this kind of a modeling is a kind of modeling to prove the point. But I think the point has been proven, and now we need to get a bit more practical. So not to say what would, you know, generally the investment in that sector mean, but rather exactly what kind of mix of services we need at this point. So I think, yeah, to return the question to the researchers is, what data do we have and what data would we need? And just to point out, Irina Hantadze also has risen her hand, so maybe she has something to contribute on this.
Hello, everybody. I am Irina Hantadze, representing CTC. So we are somehow connected also to supporting care service provision in Georgia. And I do hope that this web portal, which just Ucha mentioned, will also be a very interesting and innovative service and product, especially in times of COVID, when a lot of information needs to be accessed, unfortunately, through e-means. And as I know, Tauba plans to integrate a number of electronic services also on this web platform gradually. But apart to that, we are trying to promote care services through other means, and just now we are supporting a project in Abasha municipality, which is to replicate an elderly home care service from Zugdidi municipality, which is about providing services to abandoned elderly people on wheels. And we hope that this service, after being piloted in coming months, will be taken over by the municipality for funding next year. There is a preliminary agreement with the mayor of the municipality, and they are highly interested and already contributing to establishment of this service, which is piloted actually by one of the local community-based organizations. Of course, there is a lot of discussion what is the better solution to make such services available through municipal programs when provision is done by the municipality itself or through local community-based organizations. But I think when there is such a big lack and deficit of services, both ways are important to be tested and to be promoted. On the other hand, we launched recently a social innovation platform, which is about to raise awareness about social innovation, and through a special web portal, socialinnovation.ge. But also we are now holding a open call for social innovation projects, startup projects, and definitely care, field of care and social services as such is one of the priority areas, and we hope to receive interesting ideas from young people also for the addressing the problems in the field of the social services and social care. And that's I do agree with number of opinions which I've heard here about importance of piloting innovations and trying to support their replication and further diffusion through different means. So that is what we will be trying to promote through social innovation platform, apart from supporting a number of researches. And thank you, Jana, for using our research as a reference for your paper also. And I hope to receive this paper once it is ready, finalized actually. Thank you very much.
Okay, thank you very much, Irina, for a great presentation on the current efforts of CTC. I would also like to encourage any other, perhaps this time service or care providers in our group, if there are any, if they could share with us their experience from providing care in the current time. This is actually a concern or a question that came from one of our speakers and would be really interesting as a feedback for us. To know, or would be helpful for the speakers also to help direct the further development of this initiative. Do I see any raised hands? Anyone from the care? Oh, I see Jonas. No.
Do you hear me clearly?
Yes.
I don't have any special background in care economy, and my speech is more like a question. I want to ask you, what do you think, which role could play technology in care provision? When I say technology, I am talking, for example, about care bots and so on. What do you think about potential of using technology in elder care provision here in Georgia or in Czech Republic, for example? So this is more like a question for care practitioners rather than contributive statement. Hope understandable.
Thank you for this point, Jonas. We have Jana who raised her physical hand this time.
Yeah, I'm co-host, so I don't have the electronic hand to raise. But I mean, I don't want to dominate the discussion, so I just raised the hand because nobody else did. But then to the point that Jonas has raised, I actually had the similar question to Irina. Irina, when you mentioned the social innovation platform, I was really wondering whether you think or you expect that you would also be young people coming, you would also have young people coming with IT solutions, many of them that can actually be implemented and used in elder care to prolong independent living of people in their homes, are not so expensive and might be, I mean, the gadgets that you need for that are quite cheap, but you need a good programmer to program the whole system so that in the Internet of Things, these gadgets talk together and are able to send the correct signal to the carer. So I was wondering whether you also expect to obtain this, and experience from here, I would say, is that now we managed to implement many of these kind of projects using Internet of Things solutions in Eldercare. But a couple of years ago, because I also work for a funding scheme, so in the last program period until 2013, the projects that we had in this field actually were successful in terms of developing the solution, but were not successful in terms of implementing the solution because the elderly people were not accepting to have these gadgets in their homes. And so it's also a lot about developing trust and not only developing a super IT solution that would work on cheap gadgets so everyone can afford it. So I wanted to hear from you what you think about this.
Thank you, Jana, for the question and comment. Actually, the way our competition on social innovation works is that we are rather receiving the ideas from the different entrepreneurially minded people who have their solutions. So, of course, we will try to promote certain ideas directly directions, but I cannot exactly predict now what specifically, what type of projects we might receive. Definitely, I guess that IT component or IT products and services might be one of the clusters among the projects which we will receive. But I also do share your concern about that a lot of nice prototypes or solutions do not always work perfectly well in real life. And the limited digital literacy of certain beneficiaries target group can be also the limitation. In case of the web portal which Ucha mentioned, I think this web portal that taking into account that very risk will also target the caregivers, not only the then family members, not only the elderly people. So it will be kind of universal web portal which will provide services not solely to elderly people. Apart to that, so this project will also be very much connected to the, will also promote this web portal among the audience of retired people who are doing their digital literacy courses with Liberty Bank. So Liberty Bank is doing quite nice service for their clients, elderly clients, providing them computer skills. And this is quite a well-prepared pool of elderly people, senior people who are quite skilled and motivated, and create also kind of a motivation for their peers. So this is, I do share your concerns, and of course that needs to be addressed and balanced in the strategy of each and every new product which you offer on the market in this direction. But in terms of IT things, so we are also supporting now First Step, which is a service provider for disabled kids, and they also do services for people with autism a lot. And because of now pandemic, especially the issue of distance services became very crucial. And what we are supporting the First Step, so we have with our project, they have equipped 60 beneficiary families with the planchettes, plus providing quite a bit of training, support and coaching and supervision to support the parents and the children to be able to access certain services online on distance. So from this experience, I cannot yet make a clear judgment. It's a bit early to say how well this distance service is functioning, though I already now we can make judgment that, make conclusion that whenever you promote such IT service, training component, instruction or supervision and support component is vital. So in order to make it really implementable and working in practice, so for certain such vulnerable groups.
Thank you very much, Irina. That was really a great exchange. Thank you. We also, we're actually slightly running out of time, so there is space maybe for 2 more questions. And I know that Benedict has one, Katuna maybe 2. I also have a question, so let's turn to Ben. I know he has a very practical one.
Thank you, Carla. I wanted to follow up on the discussion of the standards of care, which I think several times we mentioned that they're important and they are sort of the basis for also service take-up and trust in the services. I know we have, I think, some colleagues from the Ministry of Health here. I hope, and if not, perhaps others can jump in with an update on where we are in the potential in developing implementing basically the standards for home care services, which some of you had worked on in the past. And I think it's even more relevant now with the, let's say, care deficit, which became obvious during the pandemic for elder care. So if there's any news regarding the possibility of actually implementing the standards. Hopefully I will not be met with complete silence, because that means we have some work to do.
Okay.
So it seems.
I don't see a current comment on this, but hopefully you'll be able to touch base via email and exchange more in detail later on. I know that Katuna has a question, and actually I would just like to jump in, maybe the speak. What really fascinated me in your presentations for both Jana and Jan is that you mentioned the cultural context in which necessarily care work is embedded, especially in Georgia. And you also mentioned the stigmatization that comes oftentimes with placing senior family members to care. And I also know that Jan is interested in behavioral research. He has experience in behavioral insights approaches. So I was wondering how how could these approaches help you put the research work further? What could help you from the local context, local knowledge, or our local experts that are present here to actually make a better intervention on the policy level? Thank you.
Yeah, that's addressed to me, I guess. Yeah, thank you, Gala, for your question. Well, I'm depending on the plans on the policy level. So far, I was focusing mostly on the micro level. Can you hear me? Yeah. So at the policy level, but the behavioral insights might be applicable, in my opinion, not only at the general policy level, but also at the local level, at the level of the daycare service. They might influence the local community as well. We might not rely on the policymakers only to change or to help to promote so-called desired behavior. So I think it would be good to know more about the stereotypes, and I tried to, during my research, I tried to understand what were the sources or roots of the stereotypes and stigmatization of the children with disabilities or the elderly people, because they were also stigmatized somehow, as far as I understood, but also about the stigmatization of the decision to make use of the institutional care if there is any available. So there were lots of stereotypes and biases that exist in every country and every community and every culture. But it's for me, it's always very interesting to understand the roots and also historical and cultural roots that lead people to the stigmatization and the stereotypes. So it's basically, yeah, what was interesting was also a stigmatization of the children with disabilities. That's maybe one specific question that's related to the hobby daycare center, because it's again, it's not only about the decision of the caregivers, but also children with disabilities, especially with mental health issues. They are supposed to be stigmatized, and there are a lot of stereotypes. So what might be the roots of the general public bias towards their situation? I'm not sure if I made myself clear. It's already a little bit late.
Okay, thank you, Jan. Maybe this is calls for a longer discussion. I see Jana wanted to jump in as well, right?
Just briefly to your question, it's really an interesting one. I think we have also experienced in the Czech Republic with this when it comes to childcare for the youngest children, 0 to 3. So there's a huge resistance, or there has been, and it's decreasing. And I think, I mean, at least what we could observe in this context, and it's not only the Czech Republic, but also Hungary, Slovakia, Poland. So let's say the Central European countries, that the cultural norm or the paradigm is shifting very, very slowly and very gently as a resultant of a couple of things. One is policy innovation, so really establishing a legal framework for a new type of care. But still, if there is resistance and culturally it's not acceptable, then there will be not such a strong articulated need from the end users. So the policymakers, of course, are not invested in committing themselves and committing funding on this. So I think for us, it worked hand in hand with, let's say, supranational pressure from the EU, and also availability of funds from the EU. So it was hand in hand a policy innovation, but also intervention from outside quite strongly, and commitment of civil servants at the Ministry of Labour, who at that time really collaborated strongly with the EC on the topic to bring this up also in, let's say, mainstream discourse. And then they piloted this idea of mini nurseries. And the moment they started opening them as a pilot project, they were full. And then they created this legal framework for daycare centers for children aged 0 to 3, which were, I mean, mothers who would choose for this kind of care were highly stigmatized. But the moment they opened any type of care, it was immediately full. So I think it's always a kind of specific mix, almost like you put everything in a blender and you just wait whether it comes out to what you wanted. I mean, creating legal framework really, opening the discussion and like trying to change the discourse and change the paradigm, and also bringing in probably some external actor. And I think in Georgian context, UNDP might be this actor who will contribute to changing the paradigm and really making a difference. Because for us, really, the European Commission was pushing so much that at some point of time, the country started to act slowly, slowly. So I think, again, a window of opportunity for UNDP probably to find ways how to bring some innovation to the attention of people.
Thank you, Jana, for this contribution. And I'm also a big fan of the mini nurseries supported by the European Commission. Unfortunately, as you know, the funding will dry up next year, and it's a big question whether in the current situation they will be supported by the ministry. Of course, you know, there's a big pressure from you know, so-called psychologist groups that advocate for the child to be nursed by the mother until they are 3 or even 6 years old. So that's a pity we actually don't have a psychologist on board today, but that's for entirely another debate. But thank you very much for this contribution. I know that Katuna had something on mind.
Very, very briefly, first of all, thanks a lot for the discussion. I had lots of discoveries, Jana, especially for the last points that you have raised. I'm fascinated by the fact that we are actually bridging the theory research, and we're talking about what comes next. And in this light, I would highlight the linking of, we are talking both about the data, both about the policy, as well as community action and what people have to contribute to. So it is, we are seeing the picture as a holistic one, which has many sides to be considered about. And it's great that we have example of the other country, the experience of the other country that can become beneficial in planning our own interventions in care. What I would like to highlight and put on the agenda maybe for another discussion is a technology issue. And thanks Jonas for raising it, because technology, it's not only about the new applications, but it's also about ethical standards. It's about data protection. It's about hardware. people giving just simply tablets, I mean, for them to be able to use them. And of course, it's training. And the fascinating example that there is a bank involved, private sector is involved in elderly education for technology. So thank you very much for this discussion. These were just my highlights that I wanted to leave at the end of this session. Thank you.
Thank you, Katuna. We will actually, we are already out of our time, so we will wrap slowly. Let us just perhaps see if anyone has a burning, pressing issue or question or comment that they would like to make before we wrap and close for the next round, actually, of our roundtable. This is not a single event. I wanted to mention this is actually a series that we plan for similar exchanges on various topics. This was strongly themed in the sense that we talked about care economy today. In other of our sessions, we plan to focus on methodological issues, how to actually create or use data for policy, for informed policy, evidence-based policy making. With various approaches reaching from behavioral insights over to micronarrative analysis. So this is just a little trailer for next rounds. Not seeing any raised hands, I will hand over to Benedikt, who wanted to also have a few words before we close our meeting. So thank you very much, everyone, for your participation. And I really look forward to seeing you next time. We will send an invitation and email, again, informing you about our next Research for Policy Roundtable. And over to Benedikt.
Thanks very much, Carla. I won't keep you long at all, seeing as we're starting to lose people, but just wanted to thank for all the ideas and feedback that you have provided, and also up on the different who are conducting at the moment. It was nice to touch base after a few months. This research has been ongoing for a while, and COVID has slowed it down, definitely. But we're hoping to get moving with much more dynamism. So we will be in touch, also sharing the results that were presented today with you, and we can have any direct two-way communication going forward. I just wanted to point out the sort of takeaways. Thanks a lot for the raised issue of evaluation, Maka. This, I think, is an important one that we often forget about. We do evaluate and we keep thinking about it, and then we don't necessarily advertise it in public. I think the successes deserve attention. So also following very closely what happens with these projects. That's definitely very good advice, and I think the research community can be instrumental in helping us to sort of extrapolate what the small successes mean for the big picture. And the second, for me, very interesting link is to the online world. I mean, we are meeting online, and I see all sorts of different indoor and outdoor backgrounds, but there is also online world that the service users, care service users use and live on. And although we have some doubts and limits to the use of technology to replace human interaction, it can definitely supplement it. And I think that what we learned about the online platform being developed and which is open to contribution is really great news. I think this is one of the ways in which we can put our heads together and somehow try to also make life more interesting and services more accessible for those that we care for and care about. So with that, thank you for all your contributions. Thanks a lot to the Czech Ministry of Foreign Affairs and Jan from the embassy for joining us and for supporting the project with the care, with the expertise that we have heard about today from our three speakers, and hoping to see many of you at the next iteration of this roundtable. So I hope you have enough time to care for your loved ones this evening, and hope that you spend it in the warmth of your houses or in the forests of the outdoors. Thank you very much.
Thanks, everybody. Thanks a lot for a great discussion.
Thank you.
Thank you. Bye-bye.
Bye. Bye. Bye. Bye.
Thank you. Bye.
Thank you very much. Have a nice evening.
Jonas, thank you so very much.
It was very amazing. I enjoyed it. I have
really
to say that also moderators were very great. That's my first impression.
Before I leave, because I'm saying goodbye, of course, now, but it was very, very interesting.
Thank you.
Thank you for your support, Sophie. We appreciate it. Thank you.
Thanks so much. Thanks so much. Bye-bye, guys.
Also, I was happy, Khatuna, that we kept the audience. That we were
not
They were, of course, during the last 10 minutes, they were going, but it was not because of the program. It was because...
you're still recording.
Yeah, stop recording. Yeah.
Stop recording. So, okay, we can catch up afterwards.
Sure.
Yeah.
That's a good point.